So let us begin with our new topic, that is management of a developmentally disabled child. So what is a mentally challenged condition? It is a condition which affects the children who are disabled due to developmental conditions. Means children disabled हैं due to developmental conditions and are not able to enjoy the privileges of a normal child. Again, mentally challenged या mentally retardation is a condition affecting the children who are disabled due to developmental conditions and are not able to enjoy the privileges that of a normal child. Now comes the IQ. IQ less than 69, that is intellectual disability. Who are considered as mentally challenged people whose IQ is less than 69. How do we measure IQ? IQ is equal to mental age upon chronological age into 100. Now certain classifications have been given of IQ classifications. Those are, if it is more than 140, very superior; 120 to 139, superior; 110 to 119, high average; 90 to 109, average; 80 to 89, low average; 70 to 79, borderline impaired; and less than 69 are intellectually disabled. Look to this very carefully. Again I am repeating for you. More than 140, very superior; 120 to 139, superior; 110 to 119, high average; 90 to 109, average; 80 to 89, low average; 70 to 79, borderline impaired; and less than 69, intellectually disabled. Now one more classification is there. Classification, that is IQ and the grading system. 70 to 80, borderline disabled; 50 to 60, moron, which is also known as stupid; 20 to 49, imbecile, that is people with weak mind; and less than 20, idiot. Again, 70 to 80, borderline; 50 to 60, moron; 20 to 49, imbecile; less than 20, idiot. Classification. Next classification is given by American Association of Mental Deficiency, in which they have classified it on the basis of mild, moderate, severe, and profound. That is whether they can be educated, trainable, or limited, or non-trainable. That it is, again it is classified as 50 to 68, mild; 36 to 51, moderate; 20 to 35, severe; less than 19, profound; 52 to 68, 36 to 51, 20 to 35, and 19, profound. Okay, clear till here? Three classifications. Definition of mentally challenged: it is a condition affecting the children who are disabled due to developmental conditions and cannot enjoy the privileges of a normal child. IQ less than 69, intellectually disabled. It is calculated as mental chronological age into 100. EQ 140, 120 to 139, 110 to 119, 90 to 109, 80 to 89, 70 to 79, less than 69. Good. Now let us start with the cerebral palsy. First condition, that is cerebral palsy. What is cerebral palsy? It is a neurological problem which is caused by damage to immature brain and causes loss of voluntary muscle control. What is voluntary muscle control? This is my voluntary muscle control. Okay, cerebral palsy, neurological problem which affects the immature brain, causing loss in the control of voluntary muscle. It is classified on the basis of neuromuscular involvement. It is classified as spastic, atheosis, ataxic, and mixed. 4. Okay, the first one is the spasticity. It has got limited head movement. Spasticity can be unilateral, can be bilateral. Involves mouth breathing. Class 2 division 2 type of malocclusion. Speech involvement, constricted maxillary and mandibular arches, involuntary muscle contraction. Limited head movement है. Can be unilateral or it can be bilateral. Mouth breathing, class 2 div 2. Speech involvement, constricted maxillary mandibular arches, involuntary muscle contraction. Now next is atheosis. It was limited head movement, excessive head movement, quick jaw movement. Class 2 div 1, class 2 div 2, class 2 div 1. Mouth breathing. Speech involvement. One more, it is the protrusion of tongue is present here. Bruxism, slow involuntary muscle contraction, both involuntary muscle contraction, here it is slow involuntary muscle contraction. Next is my ataxia, slow tremor like head and neck movement. First it was limited head movement, then in the second one, that is atheosis, it was excessive head movement, and in ataxia, slow tremor like head and neck movement. Hypotonicity of the orbicularis oris muscles will be hypotone. Visual organs may be involved, means visual organs are involved in, if question comes, that comes under ataxia. And mixed is the combination of the above. Now, what are the dental considerations seen in cerebral palsy patients? Increase in the risk of dental caries, increase periodontal problems, increase overjet, overbite and open bite. It can be unilateral or bilateral cross bites. Now, how will you manage them? Stabilize the head, reduce the swallowing problems, use proper mouth props and finger splints. Okay? Any confusion till here? I'll once again will revise cerebral palsy. Neurological problem caused by damage to the immature brain, loss of voluntary muscle control, classification, spasticity, limited head movement, unilateral, bilateral, mouth breathing, class 2 diff 2, speech involvement, constricted maxillary mandibular arches, involuntary muscle contraction. Atheosis, excessive head movement, quick jaw movement, class 2 div 1, mouth breathing, speech involvement, protrusion of tongue, bruxism, slow involuntary muscle contraction. Slow tremor like head and neck movement, hypotonicity of orbicularis oris muscle, and visual impairment may be present. And mixed is the certain combination of above. Dental consideration: high caries, high periodontal problem, overjet, open bite, overbite, unilateral and bilateral cross bites. Stabilize the head, reduce the swallowing problem, use proper mouth probes or finger splints. Okay. Now our next topic is autism. Autism. So it is defined as, according to Individuals with Disabilities Education Act, autism is defined as a developmental disability significantly affecting the verbal and non-verbal communication and social interactions, generally evident before the age of 3, that adversely affects a child's educational performance. Okay, don't run away. I'm gonna clear this definition for you. It is defined by the idea. Individuals with Disabilities Educational Act has defined autism as a developmental disability significantly involving verbal and non-verbal communication and social interactions, generally which is evident before the age of 3 and will adversely affect a child's educational performance. So in simple terms, it is a disturbance of the mental or the emotional development, causes problem in communication and relating to others, that is social gatherings, educational problems and all will come. Disturbance of mental or emotional development causing difficulty in communication relating to others. Again, once more we'll look for the definition. According to the Individuals with Disabilities Education Act, autism is defined as developmental disability significantly involving verbal and non-verbal communications and social interactions, generally evident before the age of 3, that adversely affects a child's educational performance. Okay. Now, it is more commonly seen in males than females. What are the clinical manifestation? Poor coordination, drooling of saliva, hyperactive knee jerk, parrot-like speech, epilepsy, language disturbance, poor muscle tone, poor muscular coordination, drooling of the saliva, hyperactive knee jerk, parrot-like, that is repeated speech, epilepsy, language, and poor muscle tone. Poor muscle tone. Now, one more thing we'll see. What are the problems which we usually see in these patients? We will see that there is a communication barrier Autistic child may have difficulties with verbal and non-verbal communication, making it challenging for dentists to convey instructions and explanation. Sensory sensitiveness. That is, autistic child may be hyper sensitive to sensory stimuli such as sounds, smells, sensations associated with dental problems, making it difficult for dentists to perform examinations and treatments. Behavioral challenge. Autistic child may exhibit disruptive behavior, that means that is anxiety or resistance during dental visits, making it challenging for the dentist. Limited attention span. They have a very limited ability to focus or sit for still for extended periods, so requiring dentists to adapt their approach and break down the procedures into shorter sessions. Now these were the challenges which were faced by the dentist, which communication, sensory, behavioral, limited attention span. Communication, sensory, behavioral, limited attention span. Now what are the challenges faced by autistic child? Sensory sensitivities, that is, dental environment can be overwhelming, that is strong smell, sound, loud noises, bright lights, and unfamiliar sensations. Next is communication difficulties. Autistic children have difficulty expressing their discomfort or understanding the instructions during dental procedures, which may lead to increase their anxiety and frustration level. Anxiety and fear, of course, autistic children, they experience very high anxiety and fear related to dental visits, making it challenging for them to tolerate examinations and treatments. Lack of routine and predictability. Changes in the routine or unfamiliar environment can be distressing for such children. So, it is very important to establish a structured and a predictable dental visit routine. Now, what are the common dental problems which are seen in such patients? Dental caries, difficult oral hygiene leading to increased poor oral hygiene, so caries risk. Periodontal problems, poor oral hygiene, difficulties in maintaining good oral health involves the periodontal problems. Bruxism, teeth grinding is seen commonly in them. Autistic children may exhibit bruxism, which can lead to tooth wear or TMD and other dental problems. Malocclusion. Some autistic children may have malocclusion due to normal oral habits or jaw development. Now, how will you manage? Dental caries prevention, emphasis on regular brushing with fluoride toothpaste, encourage a healthy diet, consider fluoride treatment or dental sealants. Behavioral management, use positive reinforcement, desensitization techniques, and provide a calm and supportive environment during dental visit. Sedation or anesthesia. For extensive dental treatments or uncooperative patients, sedation or general anesthesia may be considered only after consulting with the healthcare provider. Oral hygiene techniques, provide individualized treatment, oral hygiene instructions such as strategies such as visual aids or adaptive toothbrushes, or facilitate proper oral care at home. Now, collaboration with parents and caregivers, it is very important. Involve the parents and caregivers in oral health education, reinforcing good oral hygiene practices, and address any concerns or challenges they may have. Now, what are the systemic conditions which are seen associated with autism? Gastrointestinal issues. They experience gastrointestinal problems. Gastrointestinal problems such as constipation, esophageal reflux, or food sensitivities. Sleep disorders. Sleep disorders are common in autistic children, which may affect their overall well-being and oral health. Sensory processing issues. Sensory sensitivities and difficulties in processing sensory informations are common in autistic child. Epilepsy, they may be many autistic child have epilepsy or seizures, which are required with additional prevention during dental treatments. Now, you have to quote few articles. So, this was taken by American Academy of Pediatric Dentistry, Guidelines and Management of Pediatric Dental Patients with Autism Spectrum Disorder, 2020. Also by Stain Lee. This is how I have remembered. Stain Lee et al. He has given on behavioral interventions to improve oral health for individuals with intellectual disabilities. This dental home will come back later. Now, Okay. What are the behavioral techniques? Modified behavior techniques for managing dental care in autistic children involves adaptation traditional behavioral management strategies to accommodate their unique needs and challenges, and these needs will include visual supports. Use visual aids such as social stories, visual schedules, or picture cards to help child understand and anticipate the dental visit process. Number 1, visual support. Number 2, desensitization and gradual exposure. Introduce the child to dental stimuli in a step-by-step approach. First approach, second approach. Don't just do like this in front of them. You should give a gradual exposure, and the child should become familiar with the dental instruments, sounds, sensations in a controlled and non-threatening manner. Now, positive reinforcement, I hope you know. Utilize positive reinforcement techniques such as praise the child, give tokens, small rewards to motivate and reinforce desired behavior. Communication strategies. Adjust communication technique to suit the child individual's communication style. This may include a simplified language, visual gestures, alternative communication methods such as sign language, or augmentative and alternative communication devices. Okay. Visual supports, desensitization and gradual exposure, positive reinforcement, communication strategies. Next is environmental modifications. Create a sensory friendly environment by reducing bright lights, minimize loud noises, ensure comfortable seating, provide weighted blanket or sensory toys can help to soothe the child and improve their overall comfort. Tell, show, do approach. Use a tell, show, do technique to familiarize the child and dental procedure. Explain each step in a very simple language. Demonstrate the procedure using models or visual aids and then perform the procedure. This will reduce the anxiety. Parental involvement is very important. Active parental involvement should be there. They can provide comfort, support and reassurance to the child. They can also play a role in implementing behavioral management techniques at home. Patience and flexibility. Recognize that each child is unique. Their responses may vary. Exercise patience, flexibility and adapt the technique based on the child's individual needs and preferences. Okay. Now there are some more modified techniques, that is the behavioral guidance can be included, which includes the first technique is the using the picture. Using visual aids such as pictures or social stories can help autistic children understand, prepare for dental visits. These visual supports can include image of dental clinic, dental equipments and step-by-step instructions. Visual help provide a clear and concrete representation of what to expect, reduce anxiety and promoting cooperation. That is known as picture exchange communication system, text. Picture exchange communication system given it was as mentioned in the study by Hun et al 2018. This is how I have remembered the name, HUYNH et al. Hun et al 2018. This is how you will remember. Okay, see, it's not very easy to remember the author's name, so you have to tailor it according to your capabilities or potential, but you have to remember or else you won't be getting any marks in your exam. So PEX was described by as a study was done by Hun et al 2018. He had the study, he had done this picture exchange communication system and social stories for children with autism spectrum disorder in their dental setting, which was a systematic review and was published in Journal of Autism Developmental Disorder 2018. Now next is the sensory technique. Autistic children have sensory sensitivities, and addressing these sensitivities can contribute to more relaxed dental experience. Dentists can modify the sensory environment by adjusting the lighting, sound levels, temperatures to create a calm and comfortable atmosphere. Providing a sensory tools or toys such as a stress ball or vibrating toys can also help the child self-regulate and elevate the anxiety. Now the next is the animal assisted therapy given by Steinhardt T et al. 2018 and Winky et al. 2020. Steinhardt T 2018, Winky et al. 2020. In this animal assisted therapy, it involves incorporating a trained therapy animal into the dental setting, can be such as a dog or a cat, which can help to reduce the stress and anxiety in a children. The animals, their interaction can give a calming effect, promote positive emotion and distract from dental related fear. However, it should be very important that the animal is trained properly and all the necessary precautions are taken to maintain hygiene and safety. So, what were the articles we have quoted? American Academy of Pediatric Dentistry, Guidelines and Management of Autism Spectrum Disorder 2020, Steinhardt 2018, Winky et al. 2020, Hun et al. 2018. So, I hope this is clear. And some more common management is use of a papoose board and treatment under general anesthesia. Just hold on. So, sensory considerations. This is just a summary for management of autism spectrum disorder. Sensory considerations: sensory friendly environment, give deep pressure inputs, opportunity to bring their preferred sensory items such as a fidget toy or headphones. Communication and social interactions, behavioral management using desensitization technique, distraction techniques, tell-shoe-door techniques, modify approaches. Also consider using papoose board knee to knee positioning, or other techniques to facilitate examination and treatment. Use minimally invasive techniques, avoid invasive procedure whenever possible. Parent and caretaker ka active involvement should be there. Interdisciplinary collaboration is very important, and seek input and guidance from professionals experienced in treating individuals with autism. And these are the few references which I have remembered is American Academy of Pediatric Dentistry 2020. Then this is how it's a iSong. This is how I am remembering. iSong et al. 2016. Wong HM et al. 2019. Okay. So this completes our autism. This video has been little more things to be covered in this video. So I am making a second part of this video in which we will cover deafness, blindness and ADHD and general management of management of developmentally compromised children. Okay, thank you.